Professor, we also know that if your immune system is weak, you are far more likely to fall seriously ill with COVID. But what does this mean for vaccination? For instance, if you have cancer and you're on chemotherapy and you have a weak immune system, or if you have HIV and you're untreated, is it safe to get vaccinated then?
It's perfectly safe, but it's actually something even more important. It is critically important that individuals who are immunocompromised get vaccinated. That is, if you have cancer or HIV, or you have, if you're on chemotherapy, or you have a lymphoma, all of those conditions, it is very important that those individuals go forward for vaccination. Now, what happens in those individuals is that if they are very severely immunocompromised, what we find is that they don't respond well to the first dose of the vaccine, but they tend to respond well when they get a booster dose. So they have a slightly delayed response. And when they're very severely immunocompromised, sometimes they even need a third dose. So I would say that every person who is immunocompromised should be scheduling themselves to get vaccinated, and they should get vaccinated with their 2 doses if they're on the Pfizer vaccine or a single dose with J&J. And what they should do is ensure that they've taken their doses as soon as possible.
So the health department tells us that if you've been vaccinated against flu, you should wait for 2 weeks before you get vaccinated against COVID. Now, is that the same for other vaccinations? Say if you've been vaccinated against rabies, do you also need to wait for 2 weeks? And why is it in the first place that you need to wait before you get vaccinated against COVID if you've had another vaccination?
What happens is that when you give somebody a vaccine, they have an immune response that leads to certain chemicals in the blood being raised. That's part of what we call an acute phase reaction. The particular chemical I'm referring to is referred to as interferon. When you've been vaccinated, your interferon levels go up high, and that can interfere with the vaccine response, so the next vaccine response. So it's quite important that we separate out these 2 vaccines, especially because we're dealing with vaccines and we don't really know how they work together. So there are some vaccines that we do give together. They're perfectly safe to give, DTP, diphtheria, pertussis, the whooping cough. And so, we've been giving those to children for decades. But we know that that combination still is effective, and you get an immune response to each of the 3 separate antigens that are in the vaccine. When you're dealing with a vaccine like, let's say, measles or something like that, then you want to create a gap. So if you take flu vaccine today, you want to give a gap because you want your interferon levels to come down. Comes down normally within 7 to 14 days. So about 14 days later, you can take another vaccine. You can take, whether it's taking COVID vaccines or taking any other vaccines. So spacing out vaccines is important in terms of ensuring that each vaccine gets a good response from the body, that it's not being interfered with by the previous vaccination.
So, Professor, during the unrest in KwaZulu-Natal, there were people who got a bit concerned that they couldn't get to their appointments for their second Pfizer shot because the Pfizer shot requires you to take 2 shots. And our guidelines in South Africa are that if you get the Pfizer vaccine, you should wait for 42 days between the first and second shot to get your second shot. But what happens if you can't get to a site on the 42nd day? Is it okay to wait for longer, and does it make the vaccine work less well, or is it perhaps a good thing?
Very good question, Mia. So if you remember, the original recommendation with the Pfizer vaccine was that you should take the Pfizer vaccine 21 days after the first dose. So the gap between the two doses originally registered with the FDA was 21 days. But there were several studies that were done that showed that when you increase that gap, and it actually doesn't only apply to the Pfizer vaccine, it applies to other vaccines, other COVID-19 vaccines as well, that when you increase that gap, the immune response from the second dose can be better. And there's a study done in Spain, I think it was, where they increased that gap. And even in England, when they increased that gap, and they increased it all the way to 3 months, and they found that the immune responses were still very good. In fact, they were better in sometimes. So there's actually no problem with increasing the gap beyond the 42 days. In fact, your immune response may even be stronger. We recommend that you shouldn't delay that beyond 6 months. So if you can't do it in the first 42 days, if you can't do it at day 42 as you would be scheduled to do, try and get it done as soon as possible thereafter. But don't delay more than 6 months.